pregnancy
point
stage?
where you can't do.
Yes, there is. So after 20 weeks,
You can't.
no.
It's child.
Yeah, at
No,
that point,
child.
at that point, there's a heartbeat. It's a person in there.
That's
So
bro.
yeah, so it's not typically done after
Okay,
20
does
weeks.
this? Okay, you said 20 weeks, right? But there are exceptions if you go past the 20 weeks. For example, if you've been or the child is probably going to have problems growing up or has deformed or whatever, is that legal to have top
So
in that?
legalities, I mean, I think it depends. I honestly think it depends. But what happens then now is that they induce early pregnancy. So they will give you some medication that will now cause you to be in labor and actually deliver the fetus. And then it just, obviously, because of lack of development, it doesn't make it.
Okay, you mentioned on the medical part of, vaccination, that the symptoms after taking, I believe, the second pill is that you bleed a lot, even heavy clots. Does it happen sometimes that your body doesn't heal well, or during the process you just bleed more than usual? So any
Yes, it
unexpected
happens.
symptoms that someone should look out for?
Yes, you shouldn't be bleeding beyond, I think, a day or two. You shouldn't be experiencing heavy bleeding, especially. But then extensive tests are done after that, like extensive follow ups, just to check out for such things as even fever. You shouldn't be experiencing things like fever, because then that is also indicative that there's something that's maybe wrong, that shouldn't be happening. So you shouldn't be experiencing the process further than like 3 days, 2 days. No.
Do the patients come back though after like a checkup? Because me, I'm not gonna come back. See me once, never again.
That's real though.
No, I'm never coming back.
Real.
You have to come back. It's always advisable to come back so that we can keep a closer, look at your progress after that. Check your HB, make sure that everything is still fine, even your reproductive organs. We need to make sure that there's nothing that's out of the ordinary that's going on, because it is a risky procedure one way or another. So it is also important for follow-ups to be done as much as possible.